Hi there, and welcome to our informational video on common imaging modalities used to identify the cause or causes of haematemesis. Now, it's quite likely our information booklet has led you to this video, but if it hasn't, feel free to look through it using the link in the description box below. Let's get started then. So haematemesis is the medical term for vomiting blood. Now, it's not to be confused with haemoptysis, or coughing up blood, which is often related to the respiratory system and the lungs. Haematemesis is chiefly an issue of the upper gastrointestinal tract. That includes the stomach and the esophagus. So haematemesis isn't a disease, but rather a symptom. And as with other symptoms, such as headaches or even a runny nose, it can be associated with a huge number of illnesses and conditions. Now, these could be as simple as heavy nosebleeds, as painful as gastritis, which is an inflammation of the stomach lining, and you'll see that here, or as dangerous as even nastier things called esophageal varices. Now, you'll see one of those here. Now, these are enlarged veins found along the esophagus that can rupture and bleed very heavily if left untreated. In this video, we'd like to introduce you to the various imaging techniques used on a patient demonstrating these symptoms. Now, the most prevalent of these, the ones we'll be talking about, are endoscopy, CT or computed tomography, angiography, and barium studies. Whether you're a potential patient, a student, or merely interested in the subject, we hope you find this video both informative and useful.
Endoscopy is a procedure which takes a video of the esophagus, stomach, and small intestines. The procedure itself uses a flexible camera which is inserted through the mouth and is led throughout the upper gastrointestinal tract. The images are displayed on a live monitor. The risks associated with endoscopy vary depending on the purpose of the procedure. For image scanning endoscopy, there is a low risk of esophageal tearing. For tissue sampling, there is a small risk of internal bleeding or infection. How to prepare for your exam. It is recommended that you fast for at least 8 hours before your exam, or follow a special diet which your doctor has outlined for you. Certain cases will require you to either take your medications or to stop any medications which you are currently taking. It is best to consult your current physician about this. Although you won't be unconscious during the exam, you will be sedated, so it is not recommended that you drive yourself home. Therefore, we would recommend that you arrange somebody to drive you home. Before your exam, an IV will be set up, which will remain in your arm throughout the duration of the exam. There will also be a numbing agent applied to the back of your throat. The doctor will position you lying down on one side on a table. The doctor will place a mouthguard to protect your teeth and the camera. The exam should last no longer than 15 to 30 minutes. After your procedure, you will be escorted to the recovery room, where you will remain until the sedative has worn off. This may take up to an hour. Follow-up. Bloating, cramping, and a sore throat are common symptoms you may experience following endoscopy. You should contact your doctor if you experience nausea, discolored stools, or any other symptoms displayed on the screen. You should schedule an appointment with your doctor following the exam to discuss further action pending the results of your exam.
CT refers to an X-ray imaging procedure which combines a series of X-ray images taken from different angles. CT is highly useful in cases where the initial endoscopy is proven negative. CTA is the same basic concept as CT in that multiple X-rays are taken, except for in CTA, a special dye or a contrast agent is injected through a vein to highlight certain details of your body like arteries. Some of the following risks are associated with CT. You are briefly exposed to ionizing radiation. However, every step necessary is taken to keep the dose you receive as low as reasonably possible. A CT scan is unlikely to injure a fetus, but modalities such as ultrasound or MRI would avoid exposing your unborn baby to ionizing radiation. For CTA, the contrast could possibly leak from the injection site into the surrounding area and cause tissue damage and damage to blood vessels. You could be allergic to the contrast agent used, usually iodine. If you are allergic to shellfish, this could indicate you are allergic to the contrast agent, so be sure to tell your radiographer. The following is the preparation for CT and CTA procedures. Before your examination, you should inform the radiographer what medication you have been taking, as you may need to stop taking it before your procedure. You should wear loose, comfortable clothing, as you will have to change into a hospital gown. Leave any jewellery, watches, etc. at home, if possible. You may also have to remove your glasses. For both CT and CTA, you may be asked to fast for several hours before your exam. If you are diabetic, however, you may drink fruit juice to prevent hypoglycemia. For CT, you may need to fast for 2 to 4 hours, and for CTA, it may be 6 to 8 hours. Avoid caffeinated drinks such as tea, coffee, or fizzy drinks, as these could speed up your heart. Inform the doctor or radiographer if you have any ongoing health issues such as heart problems, kidney problems, asthma, or diabetes. The CT portion of both exams will be the same. However, for CTA, you will be injected with a contrast, as previously mentioned. A typical CTA or CT procedure will take about 15 to 30 minutes. You will be asked to lay flat on your back with your arms stretched above your head. Using remote control from a separate room, the radiographer will slowly move the table into the CT scanner, which is shaped like a donut. You may have to hold your breath briefly at times during the scan, and you must also stay very still. You will be able to hear the radiographer at all times, and they will be able to communicate with you and see you from the next room. So if you need a break or become anxious, you can let the radiographer know and they will make you more comfortable. The following apply for after the procedure in the case of both CT and CTA. After a normal abdominal scan and there are no implications, you can eat and drink normally and drive home. Your images will be sent to a number of specialists like the radiologist, gastroenterologist, and a CT specialist so they can be examined. They will also be sent to your referrer within 48 hours. You will be contacted by your doctor and a follow-up appointment will be made to discuss your results and, where necessary, treatment options. The following only apply to CTA exams. You will be taken to a ward to recover, and from here you may be allowed to go home or kept for observation. If there are any complications, you will have to stay the night. A tight pressure bandage will be wrapped around the site of injection to prevent it from opening. You should have someone stay with you for the day after your exam, and you may need to be driven home if there have been complications. Drink plenty of fluids to flush the dye from your body, as the contrast is excreted through urine. Avoid unnecessary activities for 2 to 3 days after the exam to avoid reopening of the wound.
Angiography is a technique used to detect and treat bleeding in the blood. It involves injecting a contrast agent into an artery before a series of X-rays are taken to check for abnormalities. Most people won't experience any complications. However, there is a small chance that any of the following may occur. Since the procedure involves piercing an artery, internal bleeding or hemorrhage are possible complications. Patients may experience an allergic reaction to the contrast agent used. If an allergy is known beforehand, however, there is medication available that will counteract the reaction. The catheter could trigger a stroke or heart attack by either causing a blockage by moving around blood clots or plaque inside the blood vessels, or the catheter may irritate the vessel, causing it to narrow temporarily. The radiation dose is very small, so it does not pose much risk at all, save for pregnant patients. Preparation for the procedure. You may have a pre-exam hospital appointment to check that you can have the test. Before the exam, you will be told if you need to stop taking any medication. Speak to your doctor if you would like to have a sedative medication to help you relax for the exam. For the procedure, you will be asked to change into a hospital gown and lie on a special table. A small cut will be made near the wrist or groin in order to access an artery, and local anesthetic will be used to numb the area beforehand so it will not hurt. A catheter, which is a long, thin, flexible tube, is inserted into the artery. It's carefully directed to the target area. and you may feel some tugging as this is done. However, it should not be painful. The catheter releases a special dye known as a contrast agent. You may feel a brief sensation of heat while this happens. X-rays are taken as the dye spreads throughout the bloodstream. And finally, the catheter is removed. Don't worry, the cut is small enough that stitches are not needed. After the procedure, you will be taken to the recovery ward where the arterial puncture site will be closely observed for a period of 6 to 12 hours. Usually you can return home the same day, although you may need to stay at the hospital overnight. It is normal for the puncture site to be sore and bruised for several weeks after the examination, and it's recommended to have someone stay with you for the first 24 hours after the exam. It's best to rest for 2 or 3 days and to avoid activities that may aggravate the puncture site unnecessarily. Remember to drink plenty of water to flush out the contrast dye, which leaves the body in your urine.
A barium study is a radiographic examination of the gastrointestinal tract. Barium X-rays assist in diagnosing abnormalities such as tumors, ulcers, inflammatory conditions, polyps, hernias, and strictures. There are little-known risks associated with the barium contrast agent. The agent is not absorbed by the body and simply passes through the digestive system. Exposure to radiation does carry risks. However, the exposure and time of the low radiation doses are always kept to a minimum in order to minimize these risks. You'll be asked to fast from midnight beforehand and avoid chewing gum. If you are taking any medications or have any allergies, you should inform your radiologist beforehand. If you are a diabetic, you should continue to take your medication as normal, and please inform your doctor or radiologist of your appointment, and it may be scheduled earlier. It is advisable to bring a light snack into the exam with you. Any unnecessary items that you bring in will need to be removed before the procedure. The milkshake-like liquid contains a contrast agent, and you may be required to swallow a small amount of bicarbonate, which helps visualize the stomach and the duodenum. Your abdomen may also be compressed to help spread the barium. For patients receiving barium meal exam only, you will be required to take a number of chest x-rays, often at different angles, to get a better view of your esophagus. You will be asked to remain still and may be asked to hold your breath during the x-ray. For the patients also receiving the barium follow-through exam, you will be asked to lie flat on a table so that the images can be taken of your stomach and duodenum. The exam table may be moved to position you at different angles. You may be asked to lie on your back, face down, and/or on your side in order to take x-rays from multiple angles. After the exam, you may experience mild dehydration and constipation. It's normal for your stools to be pale colour afterwards. This is the result of the barium leaving your digestive tract. It's also advisable to eat fresh fruits and vegetables in the days following your barium study. If you experience severe constipation or absence of the bowel movements, please contact your GP immediately.
Now folks, that concludes our video on the imaging modalities directly related to haematemesis. We hope the information we've provided has addressed any concerns you may have had and answered all of your questions. If you're looking for further information on the modalities discussed, here are the contact details for the relevant departments in a number of local hospitals. Also, more comprehensive information on individual modalities may be found on the Health Service Executive's website, links to which we've provided in the section titled Further Reading. Thanks for watching, guys, and please drop us a like if you feel we've helped you out.